Hi, I'm Adrienne, and welcome to No Awkward Question. I'm a women's health nurse practitioner, and this is where I talk about all things women's health, sexual health, whatever health related that you might feel is awkward. So I wanted to make a quick video to address a specific comment that a viewer left. On a previous video, I talked about how to deal with exams after trauma. So this person said, I've been avoiding going to see my doctor because I don't want any type of vaginal or pelvic exam, and I'm worried they won't help me if I say I don't want that. So let's talk about some very quick, easy, actionable things that you could do to help figure out your concerns and be seen by your healthcare provider, but avoid a pelvic exam or vaginal exam, especially to start. And I have my notes here, so I will be referring to those. Okay, so let's get started. Number one, when you make your appointment, please call to make your appointment. Don't make it online. I know that can be intimidating sometimes, but please call. Call because I want you to ask for a consultation only. That way they know that you don't want an exam right off the bat. You're like, hey, I'm just trying to establish care here, see if this is a good fit. If I like it, then maybe I'll stick around. Great. But consultation only means I'm just here to talk. So, if you have to make an appointment online, I would put that in the comments or the request. But I would just call to make the appointment and say, I want a consultation only. And they'll know what that means. So, that being said, when you come in for your appointment, sometimes as a provider, we'll say, if we don't know your full history, maybe you haven't disclosed to us that you had trauma or why you're avoiding an exam. We don't know, so we'll probably offer you an exam, but you can always refuse one. You can say, you know what? That's not something I want to do today. I'd love to do that at a later time. You can refuse an exam anytime. That's fine. Just knowing that that's in your control. I've had patients who come in and they're like, yeah, I was planning on an exam today, but I'm on my period. I tell them, hey, it's fine. They say, actually, I don't feel comfortable. I know you feel comfortable, but I don't. Okay, that's fine. I respect that. No worries. Number 3, ask about a small speculum. But when we think small speculum as a healthcare provider, we think the regular small speculum, which is about the size of 2 or 1.5 to 2 of my index fingers or pointer fingers. You want to ask about a pediatric speculum, which is about the size of my pinky. So that's another thing. When you call for your appointment, you can ask, do you all have pediatric speculums that you can use in the office? Most offices do, but not all. So you want to go into an office where you know that that's an option. Hi, I struggle with pelvic exams, and in the past, I've benefited from a pediatric speculum. Do you all have those in your office? That way, if they say, no, we don't stock those, then you can call somebody else. But pediatric speculums can do wonders. Now, we cannot do all procedures with a pediatric speculum, but we can do basic exams with one. We can probably do a pap smear. Pediatric speculums are awesome. 10 out of 10. Okay, if this is a non-urgent issue, let's say you're coming in and you're saying, you know what, I'm working through vaginismus, which is its whole other video by itself, but I'm working through vaginismus and I want to be able to do an exam, but I'm not there yet. Or maybe we try and you cannot tolerate it. That's 100% fine. That happens. So I will always tell people, how about we refer you to pelvic floor physical therapy and you come back in 3, 6, 9 months and then we'll do your exam. Because what you can do is you're going to go into physical therapy with goals. So you can tell them, one of my goals is to be able to tolerate a speculum or to be able to put in a tampon or tolerate a pelvic exam. And then they can say, okay, let's do what we need to do in order to get you there. So I've had patients where they come in, we establish care, I give them their referral for pelvic floor physical therapy, they come back to me 6 months later and we can do their PAP. Now, pelvic floor physical therapy in the United States is becoming incredibly much more accessible. It's not perfect though. So ask. It may be more accessible than you think. It may be cheaper than you think. So at least ask about it. It is an amazing resource. It's amazing. 10 out of 10. Okay. 2 other things that we can do before we do an exam. Let's say you're having pain, you're having irregular periods. We can do blood work. That's 100% fine. I have lots of patients who come in with concerns for PCOS, irregular periods. And we say, okay, let's do some blood work. And I'll offer them a pelvic exam or an ultrasound, and they're terrified of those things. I say, okay, let's start with blood work. If we don't get our answers, then we can talk about an ultrasound. Okay, great, cool. So we can do lots of blood work without inserting anything besides a needle in your arm. We can't do an ultrasound. It would just be on top of your tummy. It'd be a transabdominal ultrasound or a pelvic MRI. Excuse me. Pelvic MRI as well. Now, a lot of times your insurance is going to pay for that ultrasound first. So you say, okay, I'll do an ultrasound, but transabdominal only. I don't want a transvaginal probe inside. A lot of times you have a great ultrasound tech who can make that happen. Most of the time. Then, if that's inconclusive, we could talk to insurance and see if we could get an MRI covered. That's an option. Lastly, if you have asked about all these things and you feel like you haven't been heard, you feel like they're pressuring you to have an exam, you feel like everything's rushed or whatever, I always tell people, even for me, go get a second opinion. It's okay. If you have the resources and the options in your area to get a second opinion, go get one. That's 100% fine if you don't feel comfortable. So I hope that was helpful. If you have other questions or comments, leave them down below if you want me to cover different things. And then don't forget to like, comment, and subscribe. And don't forget, there is no such thing as an awkward question.